Thank you all for coming today. It really is truly an honor to have Dr. Vivek Murthy, our nation's 19th Surgeon General, with us. On behalf of the newly renamed Department of Radiology and Biomedical Imaging, and on behalf of the Medical Student Council, I welcome you to the annual Boroff-Forman Lectureship in Health Policy. I want to thank our chairman, Dr. Jeff Geschwind, and Sunny Chung, President of the Medical Student Council, for their help in supporting and organizing this event. There are over 80 people at Yale and another 6 individuals in the Surgeon General's office who have directly helped make Dr. Murthy's visit over these last 2 days a reality. I cannot mention all of them by name, but I do want to extend particular appreciation to Judy Gargiulo, wherever she is seated right now, who's worked with me for the last 19 years, and to Lieutenant Laura Netta, who is accompanying the Surgeon General on this trip, and I really thank you both sincerely. We are in a really privileged position at the Yale School of Medicine, selecting our incoming class each year from among thousands of applicants, many of whom are destined to make significant contributions in their careers as physicians, physician scientists, and leaders in public health and health policy in this country and around the world. Having been fortunate enough to serve on the admissions committee for the past 15 years, I've seen our remarkable applicants firsthand. And as a member of the faculty, I've seen our students grow and develop as they move toward their ultimate career goals. They want to make a difference in their work as physicians, a difference in the health of their patients, in the health of the entire communities, and the development of new clinical procedures, medical technology, and in healthcare leadership roles at every level. Dr. Murthy arrived at Yale in 1998, having already co-founded 2 startup organizations that support under-resourced populations, helping women become educators and healthcare providers in India, as well as advancing society's understanding of HIV/AIDS in the United States and India at a time when it was far less understood as it is today. His medical education, residency, and professional career have been focused on patient-centered care, and on a personal level, he is perhaps the best listener and the least judgmental person I've ever known. Dr. Murthy's ascent to the role of Surgeon General has triggered substantive discussion of health policy issues at every level and inspired huge numbers of medical students, physicians, and other caregivers. Our own students show increased enthusiasm for their capacity to affect positive change in healthcare delivery, disease prevention, and societal well-being. I know I speak for all of us here today in expressing our appreciation for your visit and your return to Harkness Auditorium, the site of your own white coat ceremony, countless class shows, including your own, and many other special events. Please join me in welcoming our Surgeon General, Dr. Vivek Murthy.
Thank you, everyone. Thank you so much. Howie, I can't thank you enough for not only that introduction, but really for years and years of mentorship. For those of you who are fortunate enough to be mentored by Dr. Howard Foreman, you know that his commitment to students doesn't just end when they graduate, but it continues for years thereafter. I also want to thank the Medical Student Council leaders who helped organize today's event. I want to thank the leadership of the medical school, which has hosted me and just made this return to home such a warm trip, and I really appreciate that. I also wanted to thank my wife, Alice, who's here today. We got married just 3 weeks ago. And while Alice and I met through our work doing advocacy in healthcare, we didn't realize that we, in fact, had overlapped for 3 years right here at Yale, when she was an undergraduate at Morse College, and when I was just starting in medical school. So I've always been a little slow, so it took me a little time. But with that said, it is so nice to be back here at Yale. I spent 5 years here exploring new ideas, meeting new people, only some of whom, by the way, held it against me that I attended a certain school in Cambridge for college. But before I begin my remarks, I have a confession to make. that was triggered in part by my meeting with President Salovey yesterday. You know, when I was an undergraduate, as some of my mentors, like Dr. Bia knows, I would always look for quiet places to go and to reflect, to read, to just think, to write in my journal. And after exploring a number of places here on the medical campus, I started to go further to the undergraduate campus, up Hill House Avenue. And on Hill House Avenue, I found this beautiful building that had these sprawling grounds with these beautiful trees with long, droopy branches where I could just sit underneath those trees and write and reflect and think. And so that's what I did. I would go to that house and to that yard often. I would sit there. I would take naps sometimes when I was, when I was tired. I would bring food and eat picnics, and then I would even bring friends there and say, there's this amazingly peaceful, beautiful place. You have to come there. Let's just check it out together. And so that's what I did for years. And then I started at the business school, which happened to be right across the street from this beautiful location. And I told some of my new classmates, hey, I know this gem, this incredible place that you have to come to, and we'll hang out there. And I remember I took a friend over there, and he stopped as soon as we got into to the front of the building. And he said, this is where you've been hanging out? I said, yeah, for years. He said, this is President Levin's house. So, all this to say that if later today, if you happen to walk up Hill House Avenue and see somebody in a uniform that looks like this hanging out on the lawn, just please don't tell anyone. Don't call it in. But when I wasn't loitering at the president's house in his backyard, I was spending really valuable times with friends and with faculty here at Yale. And the university came to be much more than just a place for education. It came to be a home for me. And it was here that I found a thoughtful community of students and faculty members who not only taught me about medicine and about life, but who believed in me at times when I doubted myself, when I was uncertain about the future. And it was these people who helped me build a foundation for the rest of my life. And it is for that reason that no matter where I go, whether it was to residency afterward or to jobs in DC or whatever may come in the future, I will always remain grateful to Yale for all that it's given me. The real power, though, and beauty in this place is that each of us has a different story to tell. And each of you is here for a reason. That reason isn't necessarily where you're from. It's not necessarily the job that your parents do, even if they are in medicine. But you're all here because you know that you are capable of accomplishing something big. And you know in your heart that big changes are coming to our profession and that you have a role to play in determining what this change means for our patients. When I was a student at Yale, I had absolutely no idea that I would be Surgeon General someday. But what I did know is that I was lucky to be here. My father was supposed to be a farmer in rural India. His father was a farmer who grew coconuts, tamarind, and mangoes and rice. My father for years thought that he would follow in his footsteps. But somehow, through a mix of determination and luck, he became a doctor, and he married my mother, and he made his way to the United States. When my family arrived here, we didn't have much in the way of resources or money. We didn't know many people in the United States. But my parents set up a medical clinic where my father saw patients, where my mother ran the operation, and together over time, they built these extraordinary relationships with patients, the ones that ultimately inspired me to go into medicine myself. Now, periodically, my family would reflect on our journey, and we would reflect on how grateful and lucky we were to live in a country where there were so many doors of opportunity that were open to us. And we've known, though, that this hasn't always been the case. The doors of opportunity haven't always been open to everyone in America. In fact, only a few decades ago, somebody like me may not have been welcome at a place like Yale, much less in the office of the Surgeon General. And while we know that as a country we still have a lot of work to do, there are more and more voices in this country, thankfully, that are fighting for equality and opportunity in medicine, and that is a very good thing. But the big reason that I'm here today is to tell you that we have a unique opportunity at this point in history to usher in the next golden age of medicine, an age where good health is within the reach of every person, an age where physicians are moral leaders who alleviate suffering not only by healing the sick, but also by working to prevent illness in their clinics and in their communities. Our country desperately needs this. But whether or not we create and maintain this golden age in medicine will depend on what you, the current and future leaders in medicine, do. And what do I mean by that? Well, we know that medicine cannot stand alone. As doctors and as medical professionals, we have a unique responsibility to not only care for individuals, but to do something that has been part of our legacy for millennia, and that's to safeguard the health of our community as well. But over the past few decades, something has changed. More and more doctors have actually become removed from their communities. Now, I know it may not always seem so. When you're in the middle of a busy 18-hour shift, or when you're called back to the hospital late at night to see a patient, it might feel that you are all too close to your community, in fact. But I'm not talking about that exactly. I'm talking about something larger. I'm talking about understanding who our patients are beyond their labels and illnesses. I'm talking about understanding the factors outside the hospital that influence and determine a patient's health. I'm talking about the presence of physicians in the social fabric of our communities, in our houses of worship, in our schools, and in our volunteer organizations. When you leave here and finish your training, you will come out being among the best in the world at treatment. But one thing I want to be clear about is that treatment isn't enough. If we want to celebrate the golden age of medicine, it has to start with physicians reclaiming their role not just as health experts, but as civic leaders who can understand and address the factors that contribute to illness in our communities. And it's important that we realize that we cannot create a prevention-based America all on our own. But instead, we have to work hand in hand with lawmakers, with city planners, with businesses, with nonprofits, and with educators to help build coalitions for health. And let me also be clear that the work of building a prevention-based society doesn't need to start when you're done with training or when you finally secured tenure. It can start, in fact, right now. You see, our country was founded on a radical idea that anyone from any background or origin could contribute, could make a difference in a meaningful way. And those fundamental values of fairness, of equality, and of opportunity have been at the center of our country's best moments. And fighting over what those values have meant and who they apply to has in fact been at the center of our worst moments as well. But today we live in this unique moment in history, a moment where the combination of technology, knowledge, and the breaking down of barriers have made it possible for more people than ever before to make a difference in their community. And that is why I believe that together, today, we can create a golden age of medicine. But we can only do this if we have leaders who are bold, only if we have leaders who can articulate a clear vision for health for our country. In choosing the path of medicine, all of us have chosen to become those leaders. And the country urgently needs you to be those leaders. I hear about this urgency every day when I visit communities across the country as Surgeon General. I hear from mayors and from doctors about how the prescription opiate epidemic is destroying small towns and big cities alike, responsible for nearly 16,000 deaths a year, in fact. I hear from too many parents that addiction and mental illness are still seen as moral failings in our country, instead of as what they are, chronic illnesses that need to be treated with care and compassion. But most concerning to me is the sense I get from too many people that they have lost faith in their ability to improve their own health. More and more people feel that the forces that determine their health are beyond their control. They feel that their health is increasingly in the hands of the food industry, of insurance companies, and of others who have money and clout. But there are also reasons to be hopeful. And each of us here today can show people that they do, in fact, have the power to change their health, to change their communities, and to change their country. And I draw inspiration from stories that I hear on the road as well. Stories like the one I heard earlier this week when I was in Las Vegas, and when I met young parents who every day walk their kids to school 1.7 miles each way. And they do this because they want their kids to be healthy. I also draw inspiration from programs like the one I came across in Roanoke, Virginia, where the community has come together to teach children and adults about how to prepare healthy foods with fruits and vegetables. And they've been able to document that they are changing the preference that kids have around food as a result. I also draw inspiration from Indiana, where I visited just a few days ago, and where I found that law enforcement, educators, and public health leaders are in fact coming together to take on the opiate epidemic, which has ravaged Indiana. There are inspiring stories of success like this that are dotted all across our country. But the challenge before us is that we have to make sure that these stories are the norm, not the exception. That is our responsibility. And I say our responsibility deliberately, because it's not just your responsibility, but it's mine as well. Last week, I joined with a number of nonprofit organizations and businesses to launch a call to action around walking and walkable communities. Now, I know what you might be thinking. Walking. How boring. How could that be relevant to health? But it turns out walking is, in fact, quite exciting because it turns out that walking might be one of the most powerful tools that we have to roll back the tide of chronic illness that plagues our country. Something as small as walking, it turns out, can have a big impact also on helping us to reclaim a culture of physical activity in America, something that has disappeared all too often from our schools and from our workplaces. Now, everyone in this room may understand that. But think about the people outside this room. At a time when 3 out of 10 Americans live in communities that don't have adequate sidewalks, at a time where chronic illnesses like diabetes and heart disease and cancer are responsible for 7 out of 10 deaths and over $1 trillion a year in healthcare costs, we have both an opportunity and a responsibility to communicate to people that just an average of 22 minutes a day of moderate physical activity, which you can get through walking, can significantly reduce your risk of heart disease and diabetes. Everywhere I have traveled talking about this, people have told me that they were surprised and often shocked to realize that something so simple, so fundamental, something that we have been doing for millennia, could have such a profound impact on their health. We are used to thinking that complex problems require complex solutions, but that is not always the case. And what's also extraordinary is the diversity of partners who have come together to bring this call to action to life and to reestablish a culture of physical activity in America. Partners who include not only physicians, nurses, and public health professionals, but who also include the National Collegiate Athletic Association, the NCAA, the National Council of Shopping Centers, Johnson & Johnson, and a whole host of other partners who may surprise you, but who all realize that they have a vested interest in the health of the nation. In our office, we're also talking about how to take on other tough challenges as well, from low vaccination rates to the prescription opiate epidemic, to nutrition, mental health, and emotional well-being. And this is because my goal as Surgeon General is to help build a culture of prevention in America, a culture that has active living, good nutrition, and emotional well-being at its heart. a culture where we also redefine what success means. Now, we're used to seeing success and thinking about it as a life saved with treatment, a research study done, or an article published in a top-tier journal. These are important, don't get me wrong. But we must widen our definition of success to include being a leader in your community who brings groups together to play their part in building a culture of prevention. And as a medical community, we also need to start valuing that kind of community work as much as we value traditional metrics like publishing. Because ultimate success isn't just about treatment. It means ensuring that our patients never have to walk through the door of our office or our hospital in the first place. I want us to be a nation that is as good at preventing disease as we are at treating it. That is the kind of success that we are after. In the end, we face big challenges as a country. That's undeniable. We hear about these challenges every day when we read the newspaper or watch the news. But never ever believe that these challenges are bigger than our collective will, because they are not. And if you ever doubt this, remember that it was collective will that allowed a small band of colonists to take on the mighty British Empire and win. It was collective will that allowed our nation to face down unspeakable violence and racism and pass the landmark Civil Rights Act. And it was collective will that 30 years ago allowed us to take on one of the greatest challenges of our time, HIV. This was an epidemic that was surrounded by stigma, by fear, and by uncertainty, both in the general public and even in the medical profession. I'm sure many of you may be familiar with the Ryan White story. Ryan was a young man from Indiana who struggled with hemophilia, and he was infected with HIV through a blood transfusion. And Ryan faced incredible prejudice and even hate from those who were around him. And yet when he was presented with the opportunity to lead, he took that opportunity. And he, along with his mother, Jeannie, made it their life's work to change hearts and minds. And today, thanks to that work, thanks to their leadership, over 530,000 Americans receive treatment through the Ryan White HIV/AIDS program. And although we have made great progress in our fight against HIV, we all know that we have a long way to go. Last week, I was at the White House celebrating the 25th anniversary of the Ryan White Care Act. And I was there with Jeannie, with her family, and with many of the lawmakers and staffers who helped make the Ryan White Care Act a reality. And in talking with Ryan's mother, I was reminded that without their leadership and advocacy, we would not have this law. In fact, their leadership and their advocacy produced the collective will that we needed. So the question that lies before all of us is, what kind of country do we want to create with our collective will? I want us to create a country where every man, woman, and child has a fair shot at good health. I want us to create a country where the doors of opportunity are open to all children, not just those born in the right neighborhoods, but also those who come from distant shores and who are from the forgotten corners of our country. I want us as physicians and as healthcare leaders to help create a country where health is seen clearly for what it is, the foundation that makes everything else possible, the most valuable asset we possess as a country. We need to create a golden age of health to make this happen. We need to reclaim the mantle of leadership that we had not only as healers, but as protectors of our community. And we need you, leaders who have dedicated your lives to health, to step up and to make this vision a reality. Knowing the extraordinary talent that lies in this room, I have faith that together we can translate this vision into reality. Thank you so much for having me back.
So we have mic runners on both sides and in the upper. So if you have questions, raise your hand. One of them will come to you at the mic, and we will. Do we have?
Thank you, Dr. Murthy. One thing that I heard in your talk was that we should treat addictions as chronic illnesses. And I was wondering, where should we draw the line between persecuting individuals for using and abusing prescription drugs and other illegal drugs and admitting these types of people into rehabilitation programs in order for them to get better?
It's a great question. One thing that people realize more and more on the ground who deal with addiction is that we can't prosecute our way out of the problem. That we have to recognize that addiction is real, that it's not often a moral failing, that it's something that requires treatment. And in fact, if we want to benefit most as a society, not just in terms of health, but reduce costs, then we would get people into treatment more quickly. I think the challenge we have right now is that too many people don't see it that way. And it's not necessarily because they're mean-spirited or because they don't care for the well-being of others, but it's because that's how we have been used to thinking about addiction for a long time. I was on Capitol Hill just a few weeks ago, meeting with one of our members of Congress and talking about this issue. And he quite openly shared with me that he, years ago, used to also look at addiction as an issue that was a choice, that was a moral failing that people had. But he evolved on that issue. He evolved seeing constituent after constituent, visiting families that had dealt with addiction, realizing that it's not just something that affects a certain type of person, but it's something that affects actually so many of our families, whether you're rich or poor, from urban or rural areas. So I think we are far skewed on one side of the scale. And the way that those attitudes will change is if people who have a voice speak up, if people who are affected speak up, if people who have credibility in their communities, like physicians, claim that mantle of moral leadership and speak up about these issues. Because what is so interesting to me, particularly about doctors, is that we have so much more power in the community than we realize. People often want to hear what you think, including members of Congress. So the onus often is on us to speak up, to share our views, and to do that through meetings, through public discourse, through writing letters to the editor and op-eds. The more we do that, the more I believe we can change how our country looks at addiction.
Question up there.
Way in the back. So you mentioned a large number of deaths from opioids, but you didn't mention twice as many deaths from something else, which is gun violence. And I wonder, in this era where doctors often can't ask if there's a gun at home, is it secured safely, what the opportunities for bringing down that number are. And I know it's a politically difficult issue since the topic came up in connection with your own confirmation.
Well, thank you for that question. And gun violence is an important public health issue. I've said that before. I've said that since my confirmation. And I'll say it again, because it's the truth, and all of us know it. The challenges of gun violence are complex. They're not just about laws. They're also about mental health. They're also about how we fundamentally treat each other and about the relationships that we build with each other. But one thing we know for certain is that to address any of those issues, we need to be able to have a dialogue about the topic. And too often, the issue of gun violence gets politicized. One of the things that doctors can do in a very powerful way is to help take issues like gun violence out of a political lens and to put it back into a human context by telling the stories of people who are impacted by it, including patients, their families, and their providers. This is not just theoretical. I've actually seen doctors do this. I've seen doctors write letters about the patients they've cared for who are victims of gun violence. I've seen them come and meet with lawmakers to share their experiences and their ideas for what has to change. I've seen them speak at public rallies and move public opinion and the will of a community around this issue. So this is an area in particular where I believe the voices of doctors in communities are needed. Because whenever politics seeps in to our discussions about healthcare, we need a moral compass in the room. We need a source of credibility, of moral credibility, to help bring us back to what really matters, to what the debate and issues are really about, which are people's lives. And few people are better equipped to do that than healthcare providers. That's why in the organization that I worked on before I was Surgeon General, which is Doctors for America, I worked very hard to ensure that I did everything I could to ensure that physicians had the tools they needed to speak up. But that work is far from done. What I'm convinced about is that if we were to weave education about advocacy, about how to communicate with the public and how to share ideas with your legislators into our medical training, I think that we could create a whole new generation of physicians who could be not only leaders in their hospitals and clinics, but leaders in their communities as well.
Question over there. Dr. Murthy, welcome back. You've made us all proud. And I had a question for you. With regard to your call for us as individuals to engage with our community and build a culture of trust and health and prevention, I'm curious your thoughts about how we can also focus the efforts of large institutions such as hospitals or medical schools to better align their efforts with the health of the communities which they serve.
Well, thank you so much for that question, Dr. Gross. Dr. Carey Gross was, in fact, my thesis advisor when I was here as a medical student. So I had a flashback to sitting in your office and going over drafts of my thesis. They were all great experiences. He was an incredible advisor, and I was very lucky. This is a very important question because one of the things that we realize is if we want to move toward a prevention-based society, that we have to do work as individuals, and we also have to move organizations. And some of those organizations are in the health sector, and some of them are outside the health sector. But hospitals, I believe, have a powerful role to play. And one of the interesting things that we are seeing in a post-ACA era, after the health reform law was passed, is that the incentives around payment are shifting. And the structures are changing in ways that give healthcare systems more of a vested interest, and in some cases requirement, to be engaged in assessing, understanding, and contributing to the health of their community. That is a very, very powerful set of incentives and tools. Because before, there were really not that many incentives, other from a moral imperative, for hospitals to really get involved in improving health in their community. There weren't that many incentives to ensuring that people were healthy enough that they didn't have to come to your place of business in the first place. But I think we have more of those financial incentives as we see payment systems shifting. With that said, not all institutions know how to make that happen. Not all of them know where to get started. And this includes not just hospitals, but employers as well. I meet more and more employers when I'm on the road who tell me that they recognize that the health of their employees affects the morale in the workplace and also falls directly to their bottom line in terms of healthcare costs and productivity loss. But despite knowing that, they're not sure where to get started. As one employer asked me, he said, should I start by building more staircases in the building? Should I start by putting up signs telling people not to eat unhealthy food? Should I change the food that I offer in the cafeteria? Where do I start? What should I do? And that's actually where data ends up being incredibly helpful. Because a lot of times what employers want to know is both what would be the highest yield intervention for me to pursue, and then they also want to know how to go about implementing it. And here, too, I see an opportunity for us to work with hospitals and with non-healthcare related organizations to help them understand what the data tells us about what kind of interventions in the workplace and in the community can actually help us maximally in terms of prevention. Some of this data is known, but the truth is some of it is not known. The data in workplace wellness, for example, has a long way to go. We have much more research to do there to have a truly robust understanding of the full array of things that we can do to ensure that we are reducing the incidence of illness. But that's, again, where researchers can come in and play a role in helping us identify and pinpoint areas of study that can help us in very practical ways figure out where institutions should direct their efforts. So I really think, in sum, that the the institutions need people like you who understand the importance of prevention, who understand the data behind it, and who can also be connectors to organizations that actually have the know-how in implementation. And this is, let me just make this final point because it's so important. In medicine, I feel that part of our culture is that we often feel that we have to know everything. We have to have all the tools necessary to get the job done. And that's just not always the case. You may not know, for example, which wellness programs are the best for a business to employ. You may not always know what programs or how Yale New Haven Hospital or St. Rafe should go about implementing a community prevention initiative. But as healthcare providers, I think it's increasingly important that we see ourselves as conveners, that we see ourselves as people who can bring resources and experts and others together and connect them with institutions and individuals who are in need. That shift from being individual providers of care to also being leaders who can communicate and who can convene, that's a very important shift for us to make. It is a cultural shift, to be very clear. And it's one that I'm hopeful that we can achieve quickly because truly the health of our communities depends on it.
Time for one more question back there.
Hi, thank you. I was wondering, how do you think we can better negotiate the role of government in aiding Americans in becoming agents in their own healthcare? So, for example, I'm thinking of the recent controversy of the past couple years of the soda restrictions in New York City. So how can government play a better role in making Americans agents of their own healthcare rather than being completely prescriptive?
It's a good question, and one that I referenced a bit in my remarks, because one of my great concerns is that people have lost that sense of control in their lives. They feel like they don't have the ability to determine whether they're healthy or not. And to be clear, there are forces outside that are very influential, right? There are some people who live in neighborhoods where grocery stores are not available. There's some folks who live in areas where buying fresh fruits and vegetables is just prohibitively expensive. These are real problems. But a focus on those problems alone obscures the fact that we have choice. And we often have more choice than we think. To use the example you raised of what New York attempted around soda policies back during Mayor Bloomberg's administration, while many of those policies that they attempted didn't actually pass, guess what happened to soda consumption rates in New York City by virtue of the campaigns that they ran to raise awareness about the issue? Soda consumption actually dropped significantly. Soda is just one example. Whether it's soda or whether it's choices that people make around fruits and vegetables or choices they make around physical activity, we often have more choice than we think we have. And part of what I believe we have to do as a country and particularly as a profession is to help shine a light on the choices that we do have control over. And this is not just about giving people information, because information is part of the job, but it doesn't entirely cause behavior change. I think anybody who's tried to counsel somebody about lifestyle change, after getting an elevated lipid panel understands that. But that said, in addition to knowledge, we also have to make it palatable for people to make changes in their lives. We have to make it culturally attractive for them to do it. People are more interested often in doing things where they see an emotional connection to it. People, for example, are more likely to make a change in their life because they think it will give them the opportunity to do something they love, like spend time with their grandkids, run more marathons if they love running marathons, travel more if that's something that they love to do. So we have to also find what is it that people love? What do they connect with? Because that can often be our greatest source of motivation. That, in combination with knowledge, can be very powerful in terms of engineering behavior change.
I want to thank you very much for coming.